Hi guys. Can everybody hear me? You guys are going to be able to throw up emojis and things like that to give feedback as we go here. So if you can hear me, why don't you go ahead and throw up an emoji? All right, I love that. Also, I love lots and lots of feedback. So if you guys have a question, you can throw it in there and I'll try to save some time at the end to be able to get to the questions. If you like something or don't like something, please feel free to throw up an emoji that kind of shows that. We just love lots and lots of feedback here. So in respect for everybody's time, people are still hopping on, but we're going to go ahead and get started. I am Dr. Kasi Howard, and I own Inova. I'm going to be able to tell you a little bit more about Inova as we go and kind of what we do and all of that good stuff. But I want to go ahead and get to the good stuff. So a little bit of my background, if we haven't had the pleasure of meeting before, Inova is a trauma treatment center that I opened about 6 years ago. And I hate saying I because it takes a team, right? And we've got this amazing team now. We have all levels of care. But I have been aware, even in my own conversations over the past year or two, looking at the work that I do and how many trauma stories I've heard and how many patients who are really struggling that I have that I've heard their stories and the impact that has had even on me. And I've seen the impact. We have an incredible team at Inova of outpatient and residential therapists, and I've definitely seen the impact that these stories and that working with people that are hurting has had on them. And so I am really passionate about supporting the therapist as well as supporting the client. And so you are going to see in the coming months a lot more webinars that are aimed at both, right? I remember when I did my first practicum, my supervisor told me I was leading my first DBT group, and she said, if you pay attention to this, you'll use it. And that's no lie, right? We all love DBT. And I think this same stuff. So the same stuff that if you pay attention, you'll use it and it's going to make a lot of sense for you. It's also going to make a lot of sense for your clients. So it's really a win-win. And we really hope to do a whole lot more of this to be able to support you, the therapist, as it really has been such a crazy couple years, right? In our world. And so today we're going to be talking about moral injury and trauma and kind of what that looks like. So like any good psychologist, we are going to start by a definition, right? So what is moral injury? And there's a few different definitions, but basically it's damage that's done to your conscience or moral compass when somebody perpetrates, witnesses, or fails to prevent acts that go against your beliefs or own ethical codes of conduct. So moral injury, we're going to talk about how it's a little bit different than PTSD, and it sort of adds another layer to it, right? When we're talking PTSD, you have to have that criterion A event where you either witnessed or learned about directly or your own life was being threatened. And moral injury is different. Moral injury is when it's almost like a guilt, like I could have done something, or where do I put this in the context of my beliefs? It can also be betrayal by someone who's in leadership. And so I think I've heard a lot of stories over the past couple of years of people who really feel that in healthcare settings, one way or another. However, they felt like patients were supposed to be cared for and maybe they weren't. I think there's a lot of environments to where this really applies, and the individual ends up carrying the burden of what happened that they weren't necessarily in charge of. This is my favorite definition. It is a deep soul wound that pierces a person's identity, sense of morality, and relationship to society. And I think that really sums up what we're talking about with moral injury, that it changes how we view society, because now people aren't necessarily safe. And unfortunately, sometimes maybe even we view it as we aren't safe anymore. So, as we go through this, I'm really, like I said, I'm going to emphasize the perspective of the therapist, but also understanding that you guys are going to be able to extrapolate this to your clients and situations that they've experienced. So it began when we talked about effects of war. Like a lot of PTSD and trauma research, then moral injury also began by looking at military. And so, really looking at, hey, I was given orders to do this, or, I've heard people tell stories of there was a child on the side of the road and I wanted to go help them, but I was given orders not to get out of the vehicle, right? So I couldn't go and help them. So it's not that they did something to the child or that they saw the child become injured, but it's that own sense of obligation that they weren't able to fulfill. Now we've really expanded it and we understand that moral injury can actually occur in absolutely any field, any setting, really to any body. And it often happens in the under-resourced occupations, which I really believe a lot of therapy and social work is, right? Like um, we don't typically have a ton of resources available to us as therapists. We've got the tools that we have, and that's kind of usually the end of it. And a lot of people even work in nonprofits and things like that, where they have even fewer resources. So moral injury has really gained a growing body of research over the last few years, and it's really continuing to, as we're looking at it more in terms of the healthcare field. So I am a brain nerd, and I always like looking at things in terms of the brain and how, because I believe truly, and science shows us, right, that our brains really correspond, what's going on internally in our brains corresponds to what we see on the outside, right? And the behaviors we exhibit, the feelings that we feel. And I think there's something very normalizing to helping people understand what's going on inside their brain, that it's not just this like feeling that they have in their heart, right? Like this thing that pumps blood. No, it's a feeling and it's valid because of that, but there's also things that justify it that you could actually see on an fMRI. So all my good trauma folks, anybody do EMDR? Throw up a thumbs up if you're an EMDR therapist. Um, okay, awesome. Love it. I love EMDR. All my EMDR folks know all about the prefrontal cortex and all of the things it does and takes control over. And another thing that it does, in addition to all of that, is it is the part of the brain that responds to a moral dilemma. Now, you have to keep in mind that a moral dilemma would be something that it requires decision making, right? So it's not that amygdala emotional brain, it's the prefrontal cortex, because we're problem solving. What do we do here? Figuring out something that maybe isn't as black and white. So it's these areas of the brain that actually encourage social behavior and empathy, and they help us to understand when something is a threat to ourselves than others. And then they help us to analyze reality from a social, emotional, and moral standpoint. So it's not that knee-jerk fight, flight, or fear response we see in the amygdala. It's actually the analyzing and thinking it through we see in the prefrontal cortex. These are very automatic and pro-social mechanisms that for identification, it's identifying with others, right? So it's almost that like theory of mind concept. If you go way back to your lifespan development days, that understanding that other people have a mind and think and all of that just as you do, right? Well, this is sort of an extension of that, in this idea that we actually have a part of our brain that helps us to identify with other people and to go, wow, that was a mom too. That was, that was another therapist. I mean, if you ever hear about, there was somebody stalking a lot of therapists in the San Antonio area a few years ago. And even though a lot of us were affected by that, I think a lot of us also had that sense of like, wow, that could be me. And so that's this part of the brain that we're talking about, where we really do relate to other people. So we take that part of the brain and then we have something happen to somebody else, right? Where we feel like we could have done something to stop it. And now it adds a level of empathy, and sometimes even guilt to it, instead of it just being a factual thing that happened to somebody else, because we're relating to them on that very basic human level. So here's some examples of moral injury. Failing to provide medical aid to someone. So that's kind of a reference, a very common thing I hear from military folks, is that this was a problem. Now, this can happen to anybody, right? You can see somebody injured on the side of the road driving to work tomorrow and have that sense of like, oh, I should have stopped. So that can be something. Typically, for it to really fall into moral injury, it's gonna, it would probably be a little bit more than that, but you never know what's gonna hit you at the wrong time. A military example, returning home from deployment and hearing about executions of local nationals that they worked with. This is another huge one for the military folks. Failing to report knowledge of a sexual assault or rape. This is a tough one, and we're going to really talk about this one a lot more in depth when it comes to therapists. But just to kind of touch on it now, as a therapist, when you hear, right, our child clients, we have to report. Our adult clients, it gets a little sticky ethically, whether what can we do. And I am so big on advocating. I always really try to strongly encourage my adult clients to say something about it. But a lot of times they won't, right? Like, anybody relate to that? You have clients who they tell you about something horrific that happened to them, and then it's just kind of like it gets plopped in your lap, and what else are you supposed to do with it? You can't tell anybody, you can't advocate for them. You can encourage them to, but you can't push too hard, right? Because then they're never going to come back again, or they're going to get, you're being pushy, and then you're dictating how they're responding to their trauma, and it's about you. But it's a weighty thing to have dropped in your lap, to have this knowledge and not to be able to do something with it, especially if that's your natural instinct of your personality. Failing to meet a patient's needs. Anybody ever have that patient that they just really worked their booty off for? You went home and you read extra articles and did extra research. I mean, some people go to extra trainings. They're like, you know what? I went and learned EMDR so that I could help this patient. And it didn't end like you wanted it to, right? These are things that can definitely cause moral injury in a therapist. And then not being able to save a patient. And now, I think traditionally people think about this in the medical sense of, you're in the ER or you're whatever, and the patient dies on the table kind of thing. But in the behavioral health field, it can be literal death, and it can be a life that's not worth living. They're just going on about their way, right? And that again carries with it a weightiness that, what are you supposed to do with that? And I think as therapists, people just don't talk about this enough, and we're just not really given the tools to be able to handle it. So some differences in moral injury versus PTSD. PTSD comes from a threat to our mortality, and moral injury comes from a threat to our morality. So in these examples that we just talked about, your life wasn't actually threatened. You weren't on the chopping block, so to speak, but your heart is, right? And what you believe is right and how you believe things should go. And I think as therapists, we're probably actually more impacted by this than most professions, because we do know our patients on such a deeper level, and we are so intertwined with our ethics code and our values and our love for people. That's why we got into the field, right? I think I would love to see the fMRI studies that show if our the part of our prefrontal cortex that's connected to people is even stronger, right? Because we spend so much time learning people. PTSD threatens safety. It comes, your threatens your sense of safety. Moral injury threatens your trust in yourself, your trust in others, your trust in a system. Is there a way to keep this from happening? PTSD usually immediately, right? Somebody's in a car accident, the next day they're afraid to drive. Moral injury is a tricky one because it sneaks up on you. And typically your symptoms are going to appear later. And unfortunately, I think this is where you get almost into like the complex moral injury version, to where I think we really start to see the impact when it happens person after person. And it just really depends on the field that you work in. Like I said, Inova is a trauma treatment clinic, and we are so honored to be able to walk along people in their stories. And we see all kinds of people. I mean, we see marriage and family, we see kids, we see a variety of things. But because we are a primary trauma treatment center, then we obviously we see a lot of trauma and not a lot of the worried well, right? Where you kind of get that refreshing, like, okay, this is good. She's just having a hard time adjusting to life in her dorm room, but she's going to be okay. And I feel good about that. And so when you have a lot of really difficult cases, it can really start to add up after a while. And that's when your symptoms can start to appear. Moral injury is not fear-based. You're not going to be jumpy. You're not going to be typically anxious. You're not going to be, it's not going to have that hypervigilance sense to it that PTSD does. It's really going to feel more of like a guilt, a weightiness, a malaise is what we see in moral injury. And this is a little bit blurry on my screen here because it's big, but symptoms that you see in PTSD, you see more fear, flashbacks, memory loss, the startle response. In moral injury, it's going to be more like shame, alienation, sorrow. In both, people can self-medicate. They can have nightmares. They can have anxiety and depression and anger, but you see it's having a very different flavor to it. Now, someone can very well have both, right? And then that's when, as therapists, we have to make sure that, we're treating all of a patient's needs. And we're not just going for the obvious PTSD, kind of that criterion A event, but that we're also really looking at how moral injury could be impacting this. So these are some feelings that you might see commonly associated with moral injury. We kind of talked about these, discussed in oneself, discussed in how a situation ended, discussed in leadership, discussed in a system. That's where you're really going to see that play out. So what are some symptoms? How do you know if you're experiencing moral injury? Usually you're going to have intrusive thoughts where, like, maybe you can't get a particular client out of your head, or you can't get a particular situation that perhaps they endured out of your head. It's going to be that sort of thing, or that constant replaying what they did, what they couldn't have done, what they should have done, right? That's a difficult one. Intense negative appraisals of those emotions, where you're really kind of judging yourself, the situation, et cetera, pretty harshly. Also a reliance on cognitive avoidance as a coping strategy. So whereas in PTSD, you see more of like a literal avoidance where, I'm not going to drive anymore. I'm not going to go to the park anymore. I'm not going to fly anymore, whatever that kind of scenario is. But in moral injury, it's more of like I'm just not going to think about that. I'm just going to put my head down and I'm just going to keep going kind of thing. So some effects of moral injury are social isolation, feeling very disconnected from others. And I think this is probably one of the bigger ones, along with existential crisis, where you start questioning yourself. So again, as a therapist, anybody ever question, and I can't see who does what emoji, so no one's gonna know. Anybody ever question if you should still be a therapist? Have you ever had a case or two that just made you go, oh my gosh, I don't know, maybe I am in the wrong field. Like I should have worked at the Gap. I knew that this was not for me. And now like, I don't know what I'm doing. This person would be better off with somebody else. Um, funny story, not, I mean, kind of, I'm sure you guys can relate. Do you ever have a client sit down and, it's their intake and you're going over something and you go, wow, you really need a therapist. Like you should go to therapy for that. And then it's that like, oh crap kind of moment, right? Like, oh, that's me. Okay, I got this. But sometimes it just seems like a lot. So existential crisis, maladaptive coping, and that can be, sex, love, drugs, rock and roll, alcohol, all of the things. It can be eating, not eating. It can, I don't have to tell you guys about maladaptive coping. You see probably creative ways all the time to deal with things ineffectively. And you may find yourself doing a little bit of that sometimes. An impact on family and occupational functioning. So again, this is, maybe at work, it's you change the type of clients you take. Okay, you know what? I don't want to see kids anymore. I'm not going to do it. I'm only going to see adults from now on, or I'm not going to work with that population, or you know what? I'm going to reduce my hours. I don't really think I can do this, or maybe I'm going to try something else. Maybe I'm going to go learn art. I'm going to go be an art therapist. Like, so it can change that or impact that. It can impact your family. Again, that irritability is present, and that sense of, if it was a kid situation, then, and you have kids, obviously there's a very direct impact there in how you view your kids and how you're going to help your own kids. It can even go vice versa. I mean, people who, maybe a parent had a child who was being abused and they didn't know it, so they weren't able to stop it in real time. And so then it's this like holy war, right, against any kind of child abuse. So we can really see it work both ways on how family and occupational functioning can impact one another. And then this inability to self-forgive, where you keep going, yeah, but I could have. And this is where sometimes I think as therapists, we're actually too smart for our own good, because we think, yeah, I really could have, I could have changed that. I could have done that better. I could have helped them. And the reality is you really probably couldn't have, right? You really probably did the best that you could with what you had and with their motivation, right? And with their resources, because you're not just working with yours, it's a partnership. So again, we're talking about this from the therapist standpoint, but I'm sure you can all think of clients that you can see them blaming themselves. I had somebody, I've talked to multiple clients who have left professions because, the accounting was bad and they saw people getting really messed over in the books and charged wrong, right? And so then they felt bad, they couldn't do anything about it, and then they just like left that job or that sort of thing, right? So there are way, and it had a significant impact on them. And I think on the surface, you can hear that and you can go, okay, yeah, but you left and you're in a better place right now. But I think that's where understanding moral injury and its impact can really be beneficial as we work with clients, so that we can understand when we're not just dealing with the trauma, or when we're not just dealing with the situation of a divorce, a job move, something like that. We're dealing with this deeper underlying condition. Co-occurring issues. Spiritual struggle is actually probably one of the biggest, along with PTSD. This thing of, well, if these are my beliefs and if this is my values, according to my beliefs, why didn't I act on them? And that can be a really tough one, for people of faith, no matter what their faith is. In the extreme side, we can see suicidality, but of course, anxiety and depression being very common in and of themselves. So let's talk a little bit about you, the therapist. So, or excuse me, about the clients you will see. So if somebody's coming in with moral injury, you may notice that they believe that they don't deserve to get better. And this can be a tough one to identify at first because you think it's just the trauma, but really it's because they have guilt over the trauma and what happened. Or maybe it's over a completely separate event. Maybe it's not even the trauma that's impacting if they believe they should get better or not. Maybe it's a completely separate event. So patients may not believe they can get better, they deserve to get better. They can self-sabotage therapy. They may not do their homework. They may not come back. They may get mad at you and pick fights with you. They may say it doesn't work. They may, really try their hardest to fight the process because they don't believe in their core that they deserve healing. They might feel guilt about progress. Anybody ever had a client feel guilty about feeling better? Like I really shouldn't, like I should keep just like castigating myself over and over for this thing that happened, like for the rest of my life. That's moral injury. And then of course, early dropout. Now, okay, let's talk about moral injury and the therapist. So some of the main ways we see this play out, there's 5 of them, and we're going to break these down kind of one by one. So the first one is having to make decisions that affect the survival of others or where all options will lead to a negative income, i.e. rock in a hard place. So trying to hospital, and you see there's a fill in the blank at the bottom. So if anybody wants to type in the chat or the Q&A, things where you've seen this happen and play out, then maybe we'll kind of try to call some of those out. So anybody ever agonize over whether to hospitalize someone or not, right? You know that they're not necessarily safe, but if you hospitalize them, then they could lose their job, and then that's going to be even worse, right? Or they could, it might put their kids in danger, or no one's going to be able to watch their kids, et cetera, right? And they're sitting there begging you not to, but then you don't know what's going to happen when they go home that night. Maybe they're going to be fine and they should just go to work the next day. Maybe they're not. So this is actually a really hard decision to make, honestly. And so, okay, looks like the chat is disabled, so I apologize. So you can use the Q&A, and we will, if you have, things to share there. Oh, reporting colleagues, that is a really big one. And so, hang on, lost myself here. Yes, reporting colleagues for their actions is definitely another hard one, right? We want our patients to be safe, but these people are our friends. And maybe it's, especially if it's something that was an accident, right? Or that, it wasn't malintent. To call CPS or not. Now, this is a tough one because on the surface, I'm like, oh no, we are calling like, you want to hurt your kid, we are calling CPS. But it's not always that cut and dry, right? There's those cases where it's really sketch, and it's really hard to say what the best decision is and how, because you can see how all of it's going to impact the family. So dad goes away, dad gets arrested, he can't pay the mortgage anymore, and now the family's out on the street. It's a tough one. Discontinue seeing a client who isn't making progress. Anybody struggle with this one? I know I used to specialize in eating disorders, and this was a really, really hard one because, I mean, you would have people where you're like, I feel like I'm enabling you if I keep seeing you because you're not doing anything you're supposed to do, but you're still telling yourself you're working on it because you're in therapy. But if I don't see you, then I'm not going to enable you, and maybe you'll realize that you really need to go work on this. But I don't know what's going to happen if I don't see you. Are you going to die? Are you going to get worse? these are hard decisions that we have to make a lot. And again, they're a weight that gets thrown in our lap, and then what, right? Because it's not ours to process. It's not ours to then go and do something to change, right? The next one is, and again, this is all forms of moral injury. So we're talking about it in terms of therapy, the therapist, but any situation where this happens, right? Doing something that goes against your beliefs or failing to do something in line with your beliefs. I think these two kind of group together. So we live in a very divisive world right now that's really throwing down gauntlets left and right on things. And so it doesn't really matter which side of the fence you're on. You probably have a client that's on the other side of the fence, right? Can I get a witness on this? And it's not our job to give them morality, right? So then this gets to be really hard. So maybe you have a client that's debating abortion, and you don't believe in that. Maybe you have a client that refuses to get an abortion and you believe that that would be the best option for them, right? Should someone divorce? Maybe you don't believe in divorce. Maybe you do believe in divorce and your client says, absolutely not. I don't care what he's done to me. I'm going to stay in this marriage. Beliefs on sexuality. And whether that's, number of partners, whether that's, LGBTQ plus issues, whatever that is, you have your own stance and your clients could be very different. And you may not be in a position to act in alignment with your values and what you believe on that. And again, that can be a very weighty thing where you're left without a lot of space to process. And then, of course, witnessing or learning about any of these kinds of acts can be difficult. As I said, this has really become a passion point for me as I added it up one day, and I do some contract work for the VA and kind of a variety of things over the years. And I said, oh my gosh, I think I've actually heard about 6,000 trauma stories of all different kinds. I mean, abuse, assault, car accidents, veterans, like the whole bit. And I thought, I think that's really had a huge impact on how I view the world. I don't think there's any way that I could possibly see it the same now. And so I think as therapists, we kind of don't give ourselves enough credit for this secondary kind of trauma that happens when we hear about this. And so I love this. It's not necessarily the story, it's the way we carry it. And some of us internalize and some of us take our client stuff home more than others. Some of us are really good at leaving it on a shelf. But it doesn't matter who you are, you're still carrying somebody else's burden. And you're still holding that for them, which again can be a really weighty thing to do. Experiencing betrayal by trusted others. Anybody ever have a client stab you in the back? So yes, the container. I love that. Absolutely. We tell our clients to put things in a shelf in a container in our office. And I encourage you, if you don't do this, to leave a shelf for yourself in your own office where you put their stuff in the container and you leave it there until you see them again. Let's keep theirs all in there and not for you to put in your backpack. So experiencing betrayal by trusted others. Yeah. So, I could tell you so many stories about this. I will say when I worked in an eating disorder clinic and I was a young clinician, I think I was probably just out of my postdoc, and I felt I was appropriately. I had seen this girl for about 6-7 months and, really felt like I had a good connection with her. And she was struggling with motivation and going, does anybody ever recover? And I shared, you know what, I used to have my own kind of eating issues in high school, and I'm doing much, I'm recovered and everything's great. And I kind of shared a little bit with her appropriately, I felt, in the context of therapy. And she left and basically went and told everybody in our center that I had an eating disorder, and I mean, just the whole bit, right? Like it got really interesting really fast. And I went, oh, I mean, I didn't care because at that point, I mean, I don't want to say I didn't care, it hurt my feelings, right? But I was already in a better place. So it wasn't on that level. But yeah, clients are people and we're people too. And so it is very likely that you at some point have been betrayed by a client, even if it's, you know, maybe you've seen a client for 2 years and then all of a sudden they get mad at you one day, and now you're absolutely evil and you're the worst therapist on the planet, whereas you used to be the absolute best, right? So that's a difficult one. um, and let's see. So let's talk about treatment. Um, the goal of treatment is to reflect on the morally injurious experience, consider the guilt and shame, seek forgiveness, and reconnect with yourself and others, right? So we want to be able to first reflect and understand that it happened and that it did have an impact on us. And I think that for us to be able to help our clients understand this, again, especially our clients that have other trauma, because they may not even be putting this in that context. And for us to be able to acknowledge our own moral injury is important. Consider the guilt that we are carrying from it. And then if there is a place to seek forgiveness from another human, then I think that's always a beautiful thing to do. I think most of the time, forgiveness is going to be forgiving yourself, right? And also between you and your God, your higher power, being able to go and say, okay, we're going to work through this, and I'm going to realize that I'm human and I really did do the best I can. And then I'm going to reconnect with who I know myself to be and what my calling is, and with other people. So how do you do that? Cognitive processing therapy is great for this. Anybody do CPT? Um, if you have the opportunity and you haven't been trained in CPT, it's absolutely fabulous. And if you're in the Texas area, and I don't know if they're national, but it's an organization called Strong Star. Strongly encourage you to look it up. They offer CPT trainings fairly regularly, and they are super affordable, and they are like best of the best. I learned CPT from like one of the writers of the book herself, and so highly recommend. But CPT really addresses those kind of global negative core beliefs like I'm unforgivable, the world is not safe, that kind of thing. So it can be effective for both PTSD and moral injury. So you can kind of get double duty out of that. Acceptance and commitment therapy. Any ACT fans out there? Love ACT, help you realize your purpose. It also provides a great context for meaning and growth. So I think that one of the things that's so important in any kind of trauma work, right? Whether we're talking the Criterion A stuff, moral injury, whatever it is being able to find meaning and growth. And this is such a delicate thing to not say to yourself, like, to not say to yourself, like, oh, it happened for this reason, but to be able to say to yourself that it's still, I can still use it. And so even if I didn't, it wasn't caused for the purpose of my growth, that doesn't mean that it can't be used for the purpose of my growth, right? So I think that our verbiage on that is very, very critical, because nobody wants to hear like, hey, this horrible thing happened to you for your good. That just sounds crappy. Like, don't ever say that to anybody. So, but we can say, you know what, this was horrible, it shouldn't have happened, and you are still empowered to be able to use it for whatever you want. And you can choose to use it to grow from and to learn from. That's your choice, what you do with it. So, and then approaches that focus on self-forgiveness, acceptance, that kind of thing, can also hold a lot more promise. We are still learning so much about those. as we are learning and researching more on this topic of moral injury. So I wanted you guys to be able to have a chance to experience this for yourself, and to be able to do a little loving kindness meditation. And so loving kindness meditation is great. It's great for gosh, we used to use it with eating disorders all the time. It's great for trauma. It's great for anxiety and depression. And it's also really great for moral injury. So this is something that I strongly encourage you to do live with us here. We're going to have Miss Jana Cantu, who is one of our most amazing therapists at Inova. She does music therapy and a lot of holistic things for us. And then to also be able to practice it ourselves. And so if you guys will hold on just 1 second, we are going to bring Jana on here. Let's see. Okay. Okay. So while we are, she's having a little bit of technical difficulties, so I apologize. But give me 1 second. Okay. So I'm not as good as Jana, but I can definitely do a loving kindness meditation script with you guys. And so I do encourage you that if you haven't ever done something, if you haven't practiced this before, it really is a good tool to have in your toolbox to be able to do with clients, like I said, and to be able to do for yourself as we learn on, ways to work with this. So something you can do, basically you can do this every day. It's a complement to mindfulness meditation. And it can be very formal and guided. And it can also be just a little bit more informal. So I want you to go ahead and get comfortable wherever you're at in your office and sit comfortably in your chair with your back straight. And if you want, you can go ahead and lie down. I'm going to keep talking and you don't have to see my face if sitting is uncomfortable for you. So go ahead and relax into your meditation posture and just take note of being present in your body and your environment. And just take a deep breath. And notice how your body accommodates each breath. Settle in to that feeling. Take another deep breath. And now I want you to turn your focus to your heart. I want you to begin to feel or imagine your beating heart with gratitude and warmth. I want you to call to mind a person or a pet of past or present whose steady love and unconditional acceptance of you touches your heart in a very special way. Take a deep breath and allow yourself to experience their loving kindness as if they were right near you. Happy for your presence and grateful for you just as you are. Notice how this image eases your body and your mind. Relax into a warm feeling of connection. Keep it simple. Allow thoughts to arise and to evaporate and just come back to your heart. Just watch them pass by. Take your time. And take deep breaths. Now I want you to take this loving kindness and warmth that's going through your body and put it into words. If helpful, you can imagine that these kind words are what this person, or maybe your dog or cat, they would want you to know. So you might say, may I be held in loving kindness. May I be happy and safe. May I always know that I am enough. May my heart always know peace. Repeat one of those at least 3 times in your mind as you take deep breaths and just savor it. Now, I want you to bring to mind somebody who means a lot to you, whose presence you can just relax in, and you can be fully appreciated for who you are. I want you to feel the goodness of this heart connection. Feel your mutual gratitude. And as you offer well wishes, imagine that the person is touched by them and that they are actually experiencing this happiness and peace. May they be held in loving kindness. May they be happy and safe. May they know that they're enough. May their heart know peace. And continue to repeat this. Now I want you to imagine someone that you don't care for. It could be someone that you know personally, or someone that that kind of triggers your ugh. You may think this person is unworthy of your consideration, but I want you to try to let go of that feeling as you bring them into your mind's eye. It may help them to imagine them as a young child before they became difficult to deal with, when they were just a young toddler and child fresh in the world. And let's say to them, may you be held in loving kindness. May you always be healthy in mind and body. May you always know that you are enough. And may your heart know peace. Repeat that as you take deep breaths and feel how the words can warm and open your heart. Take your time. Now, include as many people, animals, anybody that you want to bring in to your wishes. Happy or sad, loved, neglected, good, gone, whatever that is, without making an effort to envision them separately. Just maintain awareness of them all being together and send them your wishes with a sincere and tender heart. As you take a deep breath, may you be held in loving kindness. May you be happy and safe. May you always know that you are enough. May your heart know peace. Now, I want you to return to awareness of where you are, slowly coming back. And allow yourself to come back into this space. And notice the warmth that you feel. Okay. All right. So that was fun. Thanks for doing that. And that is something I do encourage you to do with your clients and to do on a daily basis. It's also great if you're doing forgiveness work with somebody to be able to guide them in that. Okay. So that is loving kindness. And it's amazing how, people ask me all the time, do I really think that people can heal from trauma? And my answer is yes, absolutely. I wouldn't be doing this if I didn't. And I do believe that our brains are hardwired to heal. We've just got to get our minds out of the way, right? We got our brains can do it, but our minds are sometimes something completely different. And so we need to learn that sometimes all it really takes is some loving kindness sent to ourselves, received by ourselves from others, and then sent to others. So now I want to talk to you guys just a little bit about ANOVA and what we do. And no matter where you're at in the country, we would certainly love to be a resource for you. We do have a large outpatient clinic. We take all the insurance, TRICARE, all the things. Blue Cross, Blue, I mean, anything you can think of, we really take, except for Medicare right now, but everything else we're good. We also have an amazing telehealth IOP, and I always say we were telehealth before it was cool. We started in 2016 being telehealth when I had to convince everybody that it was a real thing. And we are a trauma intensive. We call our women's program Relationship Renewal, and we really look at toxic relationships. We look at childhood abuse, all of those things. Our teen program is amazing. We work with teens who have had any kind of trauma, any kind of abuse, abandonment issues. We have a lot of teens who have adoption issues, attachment issues. Our men's program, we really dig into the underneath if they have substance use as to what's leading them to there. We look at trauma in men and how it gets manifested. We look at relationship issues. All of it is done through telehealth. We have morning and evening options. It's 3 days a week, 3 hours a day. And like I said, they can do it before work, after work, we've got afternoon, we've got all the options, and take all the insurance, and they can still see you for outpatient therapy. And this can just be an additional resource. We love partnering with outside providers. I'm also so pleased to say we have a residential treatment center in San Antonio for females ages 18 and up. They get 3 sessions of EMDR a week. I always want to say a whopping 3 because residential treatment centers just don't give you 3 sessions a week. But I feel very passionately that if somebody is devoting a month or longer of their life to work on treatment, we're going to give them every resource they can to get better while they're with us. They get DBT groups, CPT groups, they get shame resilience, they have music therapy, they have yoga for trauma, we have a vibroacoustic therapy bed, we use alpha stem, we use a lot of really holistic things. We do have an amazing psychiatrist who can do meds as well, but we really try to take a very holistic approach, and we take all the insurance. And it's located in an actual house. And so it feels very much like home. You can check it out and do a virtual tour on anovagrace.com. Again, we would love to serve your patients. We also have an apartments on site, 2 of them, with multiple rooms where people can do a step down to PHP. And I'm so excited. We just opened Lahua House, which is a home for women in IOP who need to transition maybe out of a bad living environment, or they just need a break or something more stable, but they maybe need lower level of care. So we do have that as well here. And then we just opened our teen residential treatment center, Anova Joy. You can check it out at novajoy.com. That's one of our therapy pigs, Luna. We have pigs, we have miniature horses, we have separate homes for boys and girls, and I do mean very, very separate. They do not intertwine. We have, chef on site, nursing care, same thing, 3 sessions a week of EMDR. They get all the therapy, they leave with good DBT skills, and it really is. It's the most beautiful, peaceful environment. We are so excited to be able to offer this. So if you guys have any questions about any of our programs, please don't hesitate to reach out. We want to be a resource for you. And yeah, let's see. I'm going to pop on to the questions real quick before I close this out. We are mental health primary, and we absolutely can do secondary SUD or co-occurring SUD. So I always say if anybody needs if anybody needs like, detox, we're going to send them to the right place. And then if they're medically stable to be able to come to us, then we can handle that. But yeah, we are primary trauma, PTSD, mental health. So all right. Thank you guys so much for being here. Such an honor. This is just my favorite thing to be able to do. And like I said, I'm so passionate about helping you, the therapist, get skills so that you can go on and be amazing for yourselves, your families, and your clients, because you do such a beautiful job. I'm like, y'all gonna make me cry. Just adore the work that you do. I have so much respect for it. And so thank you for changing lives every day. It takes a village. Please, you will receive a survey in your email soon, and we will give you your CE certificate. You should receive it by next week. Give us a few days. This was a really heavily attended webinar, which is amazing. But we are excited to serve you, and we look forward to giving you more resources in the future. Take care, guys. Thank you for being here.